Aloha, Kauai. Here's our COVID-19 briefing from Team Kauai for Thursday, April 29th. The Department of Health is reporting 13 new cases today. This is an all-time record for us by a large margin, but this is also a result of dramatically increased testing. Our health department alone tested 362 people yesterday, several times the average. More testing catches more cases, so thank you to those who have done the right thing by getting tested. All 13 of today's new cases are Kauai residents, 5 children, and 8 adults. 3 of the cases are related to inter-island travel. The remaining 10 cases are considered community acquired. We are observing unrelated community acquired infections island-wide. This indicates that for the first time, we have extensive and sustained community transmission on our island. We have 43 active cases. None are hospitalized. 107 people are in Department of Health directed quarantine. The numbers may change as investigation continues. Our cumulative case count is 283, including 246 confirmed, 2 probable, and 35 tested out of state, off island, but reported after their arrival to Kauai. I would like to invite our District Health Officer, Dr. Janet Berman, to give us a more detailed breakdown.
Thank you, Mayor Kawakami. We wanted to do a deep dive into this unprecedented case count to give the numbers some perspective. The short version of what we're seeing is this. A vast majority of our current cases are residents, not visitors. 1/3 continue to be directly related to travel, but 2/3 are community acquired. Earlier this month, we detected 2 of the more easily transmitted virus variants on Kauai, B.1.429, known as the California variant, and B.1.1.7, known as the UK variant. With these current cases, we're seeing very high levels of transmission within households and at work sites. Although we do not yet have results of variant testing, we expect our current cases will include these same variants. Finally, fully vaccinated people are mostly avoiding both the disease and the need to quarantine. Now for the details. As of Wednesday night, last night, we had 47 active cases on the island, more than we have ever had since the start of this pandemic over a year ago. 45 of those are Kauai residents, and only 2 are visitors. 32 of these cases were acquired locally, meaning that they were not directly linked to anyone who traveled. This tells us that the virus is now circulating widely in our community. This is the first time we've seen this on Kauai. 15 of the 47 cases had traveled off-island. 2/3 of the travelers were infected while traveling inter-island, and the other third was from mainland travel. Some people may mistakenly believe that children can't get the disease, but 17 of our 47 cases are in people younger than 18. Children can get and spread this disease, and they are not yet eligible for vaccine. The best way to protect them is for everyone in their household, 16 years of age and older, to get a vaccine. Fortunately, despite the large numbers of children and school-related close contacts, we have seen no transmission in school settings so far, so in-person learning remains a low-risk activity. And now the big story, vaccination status. Of our 47 cases, 40 were not vaccinated at all. 2 more were partially vaccinated, and one's vaccination status was not known. In 4 of the 47 cases, the individuals were fully vaccinated. 2 of those had no symptoms at all, meaning they tested positive but did not feel sick, and 2 more had just mild symptoms. We know that the vaccine is not 100% effective in preventing disease, but it provides a very high level of protection. And for those few who do become infected in spite of vaccine, they are unlikely to become seriously ill. The final takeaway is the importance of isolating if you're sick. Several of our cases over the past couple of weeks have attended work, school, and social events while they were feeling ill. We can't stress enough how important it is to stay home when you are sick and to contact your primary care provider to determine whether you should be tested for COVID-19. If you have not been vaccinated, please schedule your appointment now. Visit kauai.gov/vaccine for more information.
We have received a lot of questions on when we might need to move down to Tier 3. Kauai's tier rule, also known as Emergency Rule 19, requires us to hit a certain average of cases for 14 days. While moving down a tier is not imminent, we are certainly headed in that direction. But shifting tiers is just one tool in our toolbox to protect us. At this point in the pandemic, we know what needs to be done to help stop the spread of COVID-19. So please, wear your mask in public, avoid large gatherings, stay home if you're sick, and consult your healthcare provider. Take a COVID test if you feel you've been exposed, and please consider getting vaccinated if you're able. We have the tools we need, and now we need to work together to get it done. To date, we have administered more than 60,000 doses of COVID-19 vaccines on Kauai. All Kauai residents aged 16 and older are eligible for COVID-19 vaccines, and appointments are available for this week. Vaccines are widely available island-wide. To learn about where vaccines are available or how to make an appointment, go to kauai.gov/vaccine. Johnson & Johnson vaccines are limited at this time but will be available at vaccine clinic providers and some participating pharmacies. Please contact them directly for more information. If you are eligible and able, please get vaccinated. It is the most effective tool to protect ourselves and others. To schedule an appointment, please visit kauai.gov/vaccine. Starting on May 11th, Hawaii residents who have been fully vaccinated in Hawaii will be able to travel inter-island and be exempt from the travel quarantine without needing a pre-travel test. For more information on the state's Safe Travels program, including a full list of trusted testing partners and more details on the vaccine exemption program, visit hawaiicovid19.com/travel. We continue to encourage travelers and those exposed to travelers to take advantage of our free COVID-19 testing program. Anyone can walk in and get a free COVID-19 test at the convention hall Monday through Fridays from 8 a.m. to 3:30 p.m. No appointment needed, but we are experiencing a longer wait time, which is a good sign that people are taking this seriously and getting tested. The Small Business Administration is working on a new program to bring significant financial help to restaurants, food trucks, bakeries, caterers, bars, and related businesses hurt by the COVID-19 crisis. The Restaurant Revitalization Fund is part of the American Rescue Plan Act. To learn more, please visit sba.gov/restaurants. You can begin registering your account Friday, April 30th, and applications will start being accepted Monday, May 3rd. On Tuesday, May 4th, the Hawaii SBA will be hosting an informational webinar about the Restaurant Revitalization Grant. To register, look up upcoming webinars at the Hawaii SBA website. Finally today, we'd like to take this opportunity to say mahalo nui loa to our Department of Health team, including our public health officials, nurses, contact tracers, and volunteer Medical Reserve Corps. You have carried our community on your shoulders for the past 14 months while we continue to fight this virus. We have led the state in vaccinations and low case rates. This has taken a tremendous effort from a lot of people. While we see this current uptick in cases, they are working even harder to make sure we can adequately test, identify, contact trace, and mitigate the spread of disease. This is no small feat. You have been working around the clock for over a year to help protect us, and on behalf of our entire county, we wish to say thank you. We appreciate all you do and have done for our community. We know what works to help prevent the spread of COVID-19 on our island, so please wear your masks. Remember, my mask protects you, and your mask protects me. Wash your hands, keep your distance, avoid gatherings, and of course, consider getting a vaccine. Mahalo for helping to keep Kauai safe.